CHD, congenital heart disease, a malformation of the heart or the large blood vessels near the heart. The term congenital speaks only to time, not to causation. It means born with or present at birth. Congenital heart disease is the most frequent form of major birth defects in newborns, affecting close to 1% of newborn babies, 8 per 1,000. This figure is an underestimate since it does not include some common problems, namely, patent ductus arteriosus in preterm babies, the temporary condition bicuspid to cusps aortic valve. The aortic valve usually is 3 cusps or flaps. Mitral valve prolapse, drooping of a heart valve. Peripheral pulmonary stenosis, narrowing of the lung vessels well away from the heart. There are a great many types of congenital heart disease. Here is an outline of the major categories of congenital heart disease and some of the more prominent entities within those categories. Detour defects within the heart. Defects may cause blood to take an abnormal route through the heart, passing directly between the right and left sides of the heart. This occurs when there is a defect in the wall, the septum, that normally separates the right and left sides of the heart. There is a hole in the heart. The two most common types of septal defect are atrial septal defect (ASD), ventricular septal defect (VSD). Less common types of CHD with altered routes of blood flow include Eisenachter's complex atrioventricular epithelial defect, also called an endocardial cushion defect. Detour defect outside the heart, patent ductus arteriosus (PDA), is a special type of a blood-routing problem located outside the heart. The ductus arteriosus is a prenatal shunt between the pulmonary artery and the aorta that remains open patent after birth, letting blood that should flow through the aorta to the body return to the lungs. Obstructive defects. The number of types of CHD obstruct blood flow within the heart or the great vessels near it. They do so via a narrowing that partly or completely blocks the flow of blood. The narrowing of stenosis can occur in heart valves, arteries or veins. The 3 most common forms of CHD with obstructed blood flow are pulmonary valvular stenosis, aortic stenosis, coarctation of the aorta. Less common forms of CHD with obstructed blood flow include bicuspid aortic valve, subaortic stenosis, Eckstein's anomaly, cyanotic defects. Blue babies. Some types of CHD cause cyanosis, bluing. The blood pumped to the body has less than normal amounts of oxygen. This results in cyanosis, the bluish discoloration of the skin. Types of cyanotic forms of CHD include tetralogy of phthalate, transposition of the great arteries, tricuspid atresia, truncus arteriosus, total anomalous pulmonary venous return, pulmonary atresia. Hypoplastic heart defects. Part of the heart may selectively be underdeveloped or hypoplastic, as in right heart hypoplasia, left heart hypoplasia. Other developmental heart defects